collaboration between infectious disease and the Center for World Health and Medicine. We have an interest in global health problems like tuberculosis, which is now infecting about a third of the world's population. It's a massive problem. About 1.5 people die every year from this disease, and it's been fueled to become even a worse problem with the HIV pandemic. Co-infections in this country, or even more so in places like Africa, are running rampant and causing terrible medical havoc in the world. We have our first publication in this area, invited back by a major journal in the field, which will report the first work that we've done together in a collaborative fashion. This collaboration includes infectious disease, the center, as well as collaborators in South Africa, where the problem of tuberculosis is much worse, of course, than here in the United States. The second global health problem that we're very interested in trying to combat is Chagas disease, which is a parasitic infection in Latin America that causes heart disease and gastrointestinal diseases. It's the most common cause of sudden death in Brazil. A third major global health problem is malaria, which is similar in scope to tuberculosis, maybe not infecting a third of the world, but a very large number of people, and responsible for similar numbers of deaths a year as with tuberculosis. I wasn't actually working in a laboratory with malaria or doing clinical trials for malaria until the Center for World Health and Medicine came. And now we've developed this collaboration where we are able to cultivate the most severe form of malaria in the laboratory, called Plasmodium falciparum, in order to be able to look at, can new drugs kill the pathogen as the first step in drug development for malaria. Our group, our Division of Infectious Diseases, Allergy and Immunology, and our Vaccine Center are very complementary with the Center for World Health and Medicine. We have come at it historically with immunology as kind of the basic area of study applied to vaccine development. But we have a lot of expertise in different infectious diseases, and that allows us to partner with the center that has a lot of expertise in drug development and knowledge of drugs that have been maybe not successful in their first attempt to treat a human disease, but there's safety data and some mechanistic data, which is important for leapfrogging towards getting a drug for perhaps another purpose, or repurposing the drugs. And that's what we're trying to do with the center, is to utilize their knowledge and our knowledge of infectious disease to come together and make new treatments.